Well, managing cataract in a traumatic, traumatic cataract. Because the cataract doesn't present to you as a plain cataract. It's normally accompanied by some other injuries. So there are some guidelines one has to really follow. When a patient presents, one important thing is to take history. The extent of trauma, the time of presentation, the associated trauma to other parts of the eye, which is very important, and you have to assess the visual prognosis, and of course the delayed, possible delayed complications, which you have to explain, or patient should be aware of that. And the traumatic cataract workup is obviously going to be much more detailed than a routine cataract, for obvious reasons. There has to be more detailed anterior segment examination, which includes gonioscopy, zonular weakness, retinal periphery, macular health. Because every one of this is going to reflect in terms of how well he's going to see and how soon he's going to see. You have to look for subtle corneal scars. It's very, very easy if a patient presents to you much later and you have not asked, he has not given a history of trauma, and on a slit lamp examination in a hurry you might miss subtle corneal opacities, and for all that that may be the reason why his vision doesn't improve. You have to ask for detailed past history of trauma. I'll probably, if I get time, I'll show. One doctor came to me 3 months back with a cataract, and then on seeing, I couldn't really see any subluxation, nor did he give any history of trauma. And on the table I noticed a massive subluxation. I was not able to demonstrate any donuses there. And even after that, I asked him, he couldn't remember. Then his wife remembered that some years back he had developed. Traumatic cataracts accompanied by other injuries like iris trauma, corneal lacerations, and scleral perforations. Remember one thing: you deal with cataract alone and never bother to put implant, because when you put an implant, you have to be very sure his corneal powers are properly calculated. And in a trauma, the cornea keeps on remodeling, and it may take some time before it settles down and you get a true corneal power for you to. It's not coming here. Okay, now this patient, he came 15 days before with a history of injury. He developed traumatic cataract, and on examination the wound had sealed. And after that also we waited for quite some time, and now when he's taken on the table, I suspect a leak, and I see, and it's obviously there, but it was a lamellar wound, so I knew that it wouldn't bother me much. Here it's very important to remember that if you have a corneal trauma which is really leaking, then unless you suture that, you really can't go ahead with your cataract surgery. But in this case, I was able to. But I realized one thing: just to confirm the leakage, I put fluorescein, and I messed it up because my visibility went down. That's one thing. If the cornea is not healthy, your fluorescein really gives a lot of staining. So if you have suspected, fine. I shouldn't have put fluorescein there. But after that, I did inject